All right. Hey, y'all, and welcome back to my channel. On this page, I talk about technology and money. If you're new here and then watching the playback, and this is your first time watching one of my videos, welcome. I'm glad you're here. I'm glad you found my page. If you're a returning subscriber, or referred by a friend, I'm glad you're here as well. Yeah, so before I get into tonight's topic, I just like to do a little vibe check. If you guys follow me on TikTok, I always like to do a vibe check, and hope you had a good day. Hope you're having a good week. Have you just taken a moment to just stop and breathe? Have you done or said something nice for yourself today? And that's very intentional. I always like to do like a vibe check. I do a vibe check with myself. I like to do a vibe check like with my family and my friends. So yeah. So all right, y'all. So it is it's Nurses Week. So I'm recording this on let's see, on May 13th, Friday, May 13th. So it is the end of Nurses Week, and a happy Nurses Week for any nurses out there. I don't plan to be before you all very long to get my weekend started, like everyone likes to. But yeah, it's a lot going on in nursing. It's a lot going on in nursing. It is Nurses Week. It's been Nurses Week since last week. Let's see. It's also today was the Ravonda Vaught sentencing, and I watched the sentencing live. I'm not gonna front. It had me gripped up. I mean, it had a lot of nurses that I know. It had us gripped up, and I just need a. I'm not quite ready to talk, and I don't know if I'm gonna do a separate video on I already did one video on the Ravonda Vaught case and just shared a few thoughts that were my own, but I'm not sure if I'm going to do one yet on the sentencing. I watched it live. I just need a little bit of time to digest, and yeah, so so there's that. This week, yesterday, there was the nurses march up in DC. And so I know that occurred, and I know there's like, from what I understand, there are over 200,000 followers in that Facebook group, and I don't know how many nurses showed up. So that happened this week. If you are heavy on YouTube, and I talked about this over on TikTok, so Mercy Gono is a YouTuber, and she has over 1.56 million followers on YouTube. She got hacked out of her YouTube about a month ago, and it was potentially, allegedly, somebody she knew. Only one person had access to her passwords and things like that. So on her YouTube channel, she talks about like nursing and lifestyle and wellness and taking care of her family. And she had to fight to get her page back. So I talked a little bit about it over on YouTube because she shared a lot. She had to create a second, on TikTok. She had to create like a second YouTube page, and she was fighting with Google and YouTube, etc., over the past month. She finally got her page back. So the hackers did ransom her. So at first she did pay them, and then she was able to work with law enforcement authorities and Google, and she got her page back. And that was really, to me, that was good news, because she shared her journey along the way, and it just sounded like it was a lot going on. Okay. But tonight, I wanted to just do a high-level review and just talk through the new McKinsey Company report assessing the long-standing impact of the last 2 years on the nursing workforce. So I am a registered nurse. I actually work in tech. I've been away from the bedside for over 19 years. I promise y'all, it does not seem like I've been away from the bedside that long. And sometimes I think about how long I've been a nurse. It definitely doesn't feel like I've been a nurse for over 24 years. I don't feel it, but when I think about all the things that I've seen in the profession, yeah, it's been 24 years. But I'm going to share my screen here, and let's see. Okay, yes. So I'm sharing my screen. So McKinsey Company, they do a lot of, they do like a lot of consulting, a lot of reports, and this is not the first report that they have done over the last few years about the lingering impact of the virus, the panini, et cetera, on the nursing workforce. But I read through this report. I actually caught this report through Becker's Hospital Review. I've been following Becker's for about 2 or 3 years now. They do a lot of good articles and headlines on what's happening in the not just nursing, but also healthcare as a profession, healthcare as a whole. So like from physicians, payers, nursing, of course, pharmaceuticals, medical devices. They cover a lot. So they and they have different newsletters and things that you can sign up with. So I caught this in their digest yesterday, and then I had to come out to McKinsey Company and read through the report. So just bear with me one moment, okay? Let me flip over here. I got multiple screens going on. Yeah. So this McKinsey Company report falls under their healthcare systems and services. And it's really interesting article. I will be sure to link it below. Okay, here on YouTube. So what caught my attention was, and then I have read through it very high level. So I'm just going to talk through, again, these thoughts of my own. Just talk through just a couple of insights and things that jumped out to me. And I'm also going to share, if you have not seen the state of North Carolina's NC Nursecast supply and demand modeling tool, which helps, my apologies, momentary pause. I meant to put my phone on mute and I did not. So momentary pause here. Momentary pause. Okay. Yeah. If you have not, earlier back in November, when the North Carolina NC Nursecast supply and demand model was released, I did do a review of the tool, but back then I did not have like StreamYard and the ability to screen share. And so I'll touch briefly on that towards the end, which is a really good tool for helping leaders, nursing schools, the public, policymakers, et cetera, really understand the impact of the nurses shortage. Now, I have been a nurse for a long time, and I have not known a time in the profession where folks have not talked about a shortage. Okay. So I won't get into like staffing models per se, but I've always heard, that there's a nursing shortage, there's a coming nursing shortage, etc. Okay, so McKinsey and Company's article is based on a report and some data analysis, and then they do talk through, they do share their methodology a little bit further down, because anytime I read a report or an a journal article, publication, etc., that's given like data and facts, I always like to say, well, how did you, what was your statistical methods? What was your methodology? Just to make sure I'm understanding, what I'm looking at. Okay, so assessing the lingering impact of on the nursing workforce. On YouTube, you have to be careful about saying the word too much and everything. So analysis suggests potential instability and workforce gaps in the United States healthcare sector. There's a call to action for all stakeholders could help. And I think people already know. Is this big enough, y'all? Let's make sure this is inclusive and big enough. Let's see if I can make this a little bit bigger. Just bear with me momentarily. So I can make this that good, y'all. Okay. So we know, folks, it says that they open up, talking about folks and who want to become a nurse. And before what we have seen here over the last 2 years and some changes, always been a challenge. I've always heard that for both registered nurses and licensed licensed practical nurses, there has been challenges to have that continuous steady pipeline of clinicians to care for the population, for the public. So, as more coming into the profession, there's always folks who are retiring or transitioning that maybe not quite at retirement age, but transition into other careers. But then the article goes on to say that the pandemic has altered many United States nurses' careers. And then over the past 2 years, the company found that nurses consistently and increasingly report planning to leave the workforce at higher rates compared with the last decade. Now, that's interesting. And it's interesting also considering what's been going on over the past few months with different nursing unions and organizations being more vocal, not only on social media, but actually active. I've talked about Nurse Blake and the work that he's doing with Impact Healthcare. And I try to keep up with nursing news and things that are happening in the profession. There's a lot going on, like out west in California, up in New England, and the Midwest as well as the middle of the country. So in their latest survey, 29% of the nurses who participated in the U.S. indicated that's high. 29% is a lot. Indicated they will likely leave their current role in direct patient care. So that's nurses who are working at the bedside, or direct patient care could be like in an ambulatory outpatient setting, with many respondents noting their intent to leave the workforce entirely. So even as cases fluctuate, providers are still experiencing workforce and operational challenges exacerbated. So operational challenges could be like budgetary. I'm just assuming, right? This is, I'm putting my theorizing when they say operational challenges, what they mean by that. And there is an article here that links to another article. There's a link that links to another article that defines what operational challenges. To me, that could be hospital supply chain, budgetary, it could be like equipment, supplies, things like that. So a patient demand is expected to continue to rise given the growing and aging population here. And then they just anticipate that it's going to continue to increase with a wider divide between patient demand and the clinical workforce, with the specific focus on nurses. The U.S. health sector that could face substantial repercussions. So I find this article real interesting, and this research real interesting to come out right now, considering that it is Nurses Week. So my gut is telling me that the release of this is quite intentional with the timing. As recently as February 2020. 90% of McKinsey's Hospital Insight Survey respondents said workforce shortages were a barrier to increasing elective surgery volume, which is up 11 percentage points from last July. And so they're going on to say there's likely to be more patients in the U.S. Who will need care than there are actually nurses available to deliver it. So then they go on to talk about by 2025, McKinsey Company is estimating that the U.S. may have a gap between 200,000 and 450,000 nurses. That's high. That equates to a 10 to 20% gap here for direct patient care. And so they're saying to meet the demand, the United States, here, let me highlight that, would need to more than double the number of new graduates entering and staying in the nursing workforce every year for the next 3 years straight. So they're saying that in 2025 is not that far along. If you work in healthcare or any type of IT operations, I work in technology, you're always planning and doing strategy, not for the year that you're in. You're doing strategy for, the next 2 years, 5 years, 10 years. And so they're saying in this article, in 3 years, not very far from now, the United States needs to double the number of new grads entering into the profession every year. That's quite a challenge, and I don't know if that's going to happen. Okay. And I'm not being pessimistic. I'm just trying to be realistic. And so they say here that they do not directly address rapid evolutions in healthcare productivity in the article, and they acknowledge it may affect the shortage. But then they go on, they talk about some strategies. And again, I'm going to make sure to link the article if you're curious in their methodology. I won't dive into it here, but they talk about how they got to this information in which data sources they use to come up with these projections. But I do want to jump down So we already know, we've heard and read the news reports how the sicknesses of the past 2 years has impacted the workforce. But I do want to call out this interesting here, this interesting setting here, this interesting section here. They're saying, but their analysis by 2025, the three challenges that's going to be facing this country effectively meeting patient care needs includes a decreased supply of the absolute RN workforce. So those are nurses who are available to work, increased patient demand related to the virus, and then also continual work setting shifts and increased demand due to a growing and aging population. And it's interesting because I know things in healthcare technology and patient care, such as hospital at home, right? Hospital at home and those programs have increased, especially once some hospitals had to like close services and stop elective like service lines or stop like elective surgeries. I know there was an increase in hospital at home. I believe back in February, Vanderbilt, I believe, started their hospital at home program, and there's several other very large health systems in the United States. So hospital at home is not your traditional home health care model. It is acute patient care within a patient's home. Now, there is criteria around patients. You just can't take an acutely ill patient from a hospital setting and just send them home. There are some criteria like around electricity, family situations and things like that have to be assessed. But that's when this article talks about continued work setting shifts, that it immediately made me think of like hospital at home programs. Okay, so they go on to talk about the decreased supply a little bit further of the absolute nursing workforce. But what I wanted to go to, again, this article is quite lengthy and I don't want to be before you long. What I wanted to get to is their recommendations. Their actions to consider. Okay, just give me one moment, a momentary pause here. All right. So what I wanted to really get into before I wrap up and just very briefly touch on NC Nursecast, the supply and demand model, which the North Carolina Board of Nursing worked with a statistical institution over at UNC Chapel Hill to help policymakers and healthcare organizations and nursing schools in the state of North Carolina really look at data for our state, and so people can understand in different areas of the state what the projections are going to be. But before I go to that tool, I wanted to just touch briefly on the actions that McKinsey Company are recommending for folks to consider, organizations, etc. And I think they give about 4, and they do. Says right here. So number 1, attracting more people to nursing roles. So bear with me here. Attracting more people to nursing roles. So casting nursing as an attractive and exciting career opportunity can help more people understand how they could thrive in the profession. So I feel like folks understand that nursing is an exciting career. I'm not sure when they say attracting as an attractive career opportunity, like what it is lucrative. Like there's a lot of things that you can do in nursing besides bedside nursing. And I know as I interpret this article, this is talking about nurses in direct patient care roles. So I'm assuming when they say attractive career opportunity, that's what they're referring to, because there's a lot you can do. You can work in the bedside, but you can also work in like a perioperative suite. I work in tech. I met a nurse 2 or 3 weeks ago who works in predictive analytics. So there is a lot. I'm assuming that's what they mean. So they go on to say making the value proposition and pathways for a nursing career to be more visible and clear for high school students and mid-career joiners may also help. And I feel like this is feelings are not facts, and I understand that. But I feel like folks do a good job of that. I feel like nursing schools, and again, I'm just one out of millions of people. But there are high schools that have like healthcare programs, and I know there are some nursing schools that try to do what they can to recruit or send recruiters to high schools to talk about the profession. And I was in a meeting last night, and they were talking about, even with that, there is still a shortage of professors for nursing programs and clinical instructors. So there's a crunch there as well. So then they go on to talk about where that would start. And again, this is not just for registered nurses, but also nursing assistants, licensed practical nurses. And it's interesting, they didn't mention LVNs here, licensed vocational nurses. And I've read this article about 3 or 4 times, and I just realized that they did not call out LVNs. But I'm guessing when they say LPN, they're also talking about LVNs, but those are 2 different types of nursing roles. But go on. They talk about requiring institutions to identify and train new sources of talent, like from adjacent industries and from international programs, which I feel like the United States does that. Especially with the Filipino nurses and nurses coming from Canada, et cetera. And then talking about innovative partnerships. They also recommend, they being McKinsey in this article, increasing the number of academic and clinical spots. Now, you can do that, but then you also have to have folks you have to have enough nursing professors and then also enough clinical educators, which they acknowledge that clinical rotation spots. So that being, places for these nursing students to go and get their training outside of like simulation labs, and also mentors. So on TikTok, and I did go viral on TikTok for the very first time about 2 or 3 weeks ago. And I got like, one of my videos got like 30,000 views. I think at 32,000, which was unexpected for me because I was just talking about being a nurse working in tech. But when that video hit, I had so many, I don't know if they were nursing students or just people DMing me asking, do you do mentoring? And I'm like, I don't. I have for master's nursing students, but it's interesting how many folks are looking for a mentor and need mentors. And even if they aren't a nursing program, it does help for nursing students to have someone who may not necessarily be affiliated with that program to give them encouragement, because mentorship goes such a long way, not just in the nursing profession, but for a lot of professions, teaching, engineering, etc. So I definitely agree on the mentors. And I think about that situation I ran into about 2 weeks ago. So then they go on to talk about, to increase the number of spots, higher education institutions could increase resources. That's money. To me, resources is money, but or things that equate to money. And healthcare providers could find ways to support training while still often managing their own staff shortages. Then they go on to talk about some things that regulatory agencies could do around flexibility, around accreditation, and streamlining timely licensure processes. So that's like around taking the NCLEX, or I forget the name of the licensing that LPNs and LVNs take, but they do take, it's like NCLEX dash, and it's slipping my mind. But so, and streamlining the timely licensure processes. Okay, so reimagining clinical education. So this one was interesting because I do know, I'm based in the state of North Carolina. I do know that the North Carolina Board of Nursing has a simulation council that they talk about ways that to train nursing students and others in sim labs or simulation labs. So, but in this article, they talk about institutions partnering with healthcare providers to identify and address skill gaps and connect potential candidates with employers. So they give an example of what Cleveland Clinic, Metro Health, and university hospitals in Ohio partnered with a community college as part of a Workforce Connect healthcare sector partnership with a goal, this is a great goal, to hire 100 entry-level full-time workers by June 2022. So that gives the opportunity for folks to get their foot in the door early. And then if the opportunity is good, for both. If it's mutually beneficial, that would encourage the person who participate in that program to stay on at that facility after graduation. So then I'm going to go on and just touch on the last one. Oh, here's where they're talking about virtual classes and simulation-based learning activities to help with educational. Again, I know there are some board of nurses that have simulation councils. And then the last one is just innovative care delivery models to reduce the burden on nurses. Now, this is really interesting to me because they equate things that, and this is to me, like innovating care delivery models to reduce burden on nurses. To me, this is where technology comes in and finding ways and technology solutions that makes nurses' jobs easier, such as, for example, things that can be done to reduce the burden of nursing documentation, to like less clicks and saves and pages to go through when you're documenting, et cetera. And they give an example for how the airlines move to more a customer-centric model for seamless integration of data and flight options. So you think about how easy it is for yourself as the consumer to book a flight now if you're if you were born in a certain year versus how it was maybe 25, 30 years ago, and taking that same model and transforming healthcare. So they go on to say how sensitive healthcare information and interpretation are often analyzed via digital platforms that only require clinical intervention in extreme circumstances. So to me, that's talking like using how you can use like AI and early detection models to help, like, for example, using some AI algorithms to help predict sepsis a little bit earlier and take that a little bit off the nurse, almost like using AI to partner with the nurse to provide an enhanced level of care. So innovation, the goal of innovation is to improve patient engagement and outcomes while allowing nurses to focus on their care, on those who need their help most. So healthcare providers may consider enabling such change through digital, clinician, regulatory, and labor union collaboration. Like I'll be honest, I do not know a lot about nursing unions. I know they're active in some states right now. I have never been a member of one, so I can't speak to the benefits, pros or cons to union collaboration, but it's referenced here in this article, so clearly there must be some type of benefit there. And then they talk about what healthcare providers can do, what the regulatory around federal and state governments can do, and what the private sector can do, and just society as a whole. So yes, I will be sure to leave a link to this article here at in the description box of YouTube. And before I end tonight's live, I wanted to share the NC Nursecast supply and demand model, because I think what the North Carolina, and I'll be honest, I don't know if any other states have created similar supply and demand models for their states. And I did do a review of this statistical tool about 5 or 6 months ago in November when it first came out. But back then, I did not have screen sharing ability here in YouTube. So in that video, I was just talking about it and thinking about like different use cases. So this time, I'm going to actually just show you the tool. So this NC Nursecast is an interactive, it's a web-based tool. You do not need to have any like statistical analysis training. You don't need to know like not smart sheets. What's the word? There's so you do not need to have like statistical analysis training to use this tool. But what the tool does, it allows anyone, is open to the public. It's a publicly accessible, free of charge, free to use tool that allows you to forecast future supply and demand for registered nurses and licensed practical nurses in various practice settings in North Carolina. So what I found interesting about this tool back then when I looked at it is you are able to put in certain data points, such as what area of the state are you in? Do you want to look at new grads? Do you want to look at nurses who have been in the profession for a while? And then look at future forecasting. So I'm going to share it here. It's down here at the bottom of the screen. So you can come to their website and they talk about, because anytime I'm looking at data, I'm always like, well, what is the methodologies? They do talk about the methodologies, and it is based on historical data from the North Carolina Board of Nurses Health Professions Data System, population data from the North Carolina Office of Budget and Analysis, and then an advisory committee as well. Okay, and then they have a little YouTube video here where you can come and watch and how to use. So this is where I was talking about you do not have to have statistical training to use the tool. So let's just put in some data points here really quickly so you can just give you an idea. So do you want to look at a registered nurse or LPN? You could toggle between the two. You can do a total, you can do head count versus FTE. FTE stands for full-time employee. And for example, in organizations I worked in the past, a full-time employee would be someone who works 40 hours a week, or I think it's the 2080 hours per year. I think it's FTE. It's either 2040 or 2080, one of the two. So that equates to a 40-hour work week. Okay. So let's just do it by head count. So then you can do it by Medicaid region, AHEC, or by metro, non-metro, like a Charlotte versus like, say, Troy, North Carolina. You can do it by location. Oh, actually, you cannot do it by location, but I thought you could at one point. I thought you could like break it down by areas of the state, or is it may be once the map shows. So then you can look at by hospital. Let's say this by the setting that nurses work in. And then you can say, okay, what is my supply scenario of registered nurses? Is it like a baseline supply? Is it nurses who are doing an early exit, either by 2 years or 5 years, delayed exit, right? So folks who may delay their retirement, reduction of in out-of-state supply, 10% increase. So like say if there's a 10% increase in nurses graduating from programs, or like an early exit. So let's just stick to the basics, okay? And then you can say show. And then it actually creates your chart for you, which you can then like save it as an image. So like say if you're creating this an analysis for like your organization and you want to put it in a presentation, you can do that. You can also download it as CSV. With CSV, you can convert CSV really easily to Microsoft Excel, and then run it like pivot tables and do even more in Excel on your own. But then it runs your data. And then you can see here in this scenario, it takes it out to 2023. And then it gives you, I can't hover over because you see my little boxes moving as I jump year to year, but you can see the supply, the demand, the difference, and also the percentage. And then you can see more data down here. You can see your table, like what your data is based on. And then you also have your FTE versus headcount. There's a lot you can do with this tool. And I will be sure to link in the description box my review of the tool. I thought it was great. And in that review of the tool, I think I gave like 5 or 6 different use cases that I thought about that could be used with this tool by colleges, by hospitals, by policymakers, etc. So if you have not seen that video, I recommend you go watch it. So yeah, y'all, that's it. I did not want to be here before you guys long here on Friday. I'll be sure to leave my description, my contact information in the description box. If you are watching for those who come back and watch the replay, You can always feel free to leave a comment. Thank you to all the new subscribers. Ever since I went viral on TikTok again, I appreciate everyone who has shared my videos with your nursing students. I've had people message me and say, "Oh, my sister is a nurse and she's interested in some things." So I appreciate everyone who has shared my videos with your friends and your family members. I try to make this page inclusive and keep it positive, for not just around the profession of nursing, but also the things I talk about, money and technology. Like I always tell you guys, don't believe everything I say. Do not believe everything I say. Always do your own diligence with anything I say or just anything that you come across on the internet, because my opinion is just one of many. But I always welcome like comments and folks messaging me. Just keep it respectful, right? So I always want this to be kept an inclusive and respectful place. And if you have not, definitely go check out Mercy Gono, BSN her YouTube channel. She is back. She has a wonderful personality. She is a nurse and she fought the hackers. And she worked with YouTube and Google and law enforcement officials, and she got her page back. And it was just, she has a wonderful personality. So yeah, y'all, that's it. So remember, be good to yourself, say nice things to yourself, and I'll see y'all in the next video.